Pre-genetic screening. What does it mean? Where we do PGS. Why we require PGS? Pre-genetic screening, this is the recent technology where we prepare the embryos by the process of ICSI, ICSI, and after we get the embryos, after we get the blastocyst, we take few cells from the blastocyst and we prepare the DNA and we see what is the problem in that embryo, whether is there any problem or not. Is the embryo is very good or not, whether it is all the chromosomes in that embryo are proper or not. We will examine if there is any embryo which is not good, which is chromosomally abnormal, where one gene is deleted, where some genetic material is additionally present, where there is beta thalassemia gene, where there is sickle cell anemia gene, where there is some other problems, G6PD deficiency, where there is any Down syndrome gene, and there is any problem on the gene number 13, number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 up to 23, including sex chromosomes. We do all tests. If there is really any problem on any gene, we take out the embryo, we remove that embryo. Where the embryos are properly happened, like where all the embryos, all the genes are proper. Suppose we get 10 embryos, out of 10 embryos only 2 embryos are very good, there is no problem at all in those embryos. Those 2 embryos we select and we take out and we transfer into the endometrial cavity of the mother. So we don't get any abnormal child. Where you require to go for PGS, in what conditions? Suppose your wife is having more than 5 or 3 or 4 abortions, repeated abortions. What could be the reason? In this case, actually we will think that there are some problems in the genes, genetic problem, there are some problems in the immunological, or there are some other problems. All these things we will think, we will put in the mind, and there we should go for the PGS procedure. And sometimes IVF and ICSI we have done so many times and all are failing. So what could be the reason for failure? Genetic problem. So all the genes will be again examined, and all the embryos where the genetic problem is not there, we have to pull the embryos and we have to keep it in the endometrial cavity. Suppose if the age of the mother is very high, suppose the 42 years old lady, and till now she has not she has not conceived, this is the first time, so there are so many problems. See, the Down's baby, the Down syndrome will be very, very high if the age of the mother is more than 40 years. It will be 1 in even 25. If the age of the mother is 48 years old, the Down's baby will occur 1 in 11 cases. So high. And we should not suffer with the babies like that. We should not suffer even the babies, and we should not even suffer, we don't want to suffer even the parents. So in certain kinds of people, we advise them to go for pre-genetic screening. And maybe the history of chromosomally abnormal baby in the in their family itself, maybe brother's family, or maybe own brother is having some problem, own sister is having some problem, and maybe this mother is having some problem. So again we have to think whether the same problem is going to occur for the coming baby. Then also we have to do pre-genetic screening. Why we should do pre-genetic screening in youngsters? Even youngsters also, maybe husband party is having some problem, some genetic defect. Even single gene mutations will happen sometimes. Nowadays single gene mutations are occurring. There are so many other factors. Maybe everybody is nowadays telling that even cancer is due to some genetic problem, diabetes is due to some genetic problem. There are so many other things. Now the reasons they are telling is genes. Previously diabetes is due to the familial. They used to say familial, but now it's no more familial. It is due to gene. What all kinds of abnormalities we will get? Suppose the mother is having torch infection positive. Previously she was having so many abortion. Previously she was having some defect in the baby. So they have removed the baby. Now what we should do? We should advise them to go for PGS. So is PGS is required for everyone? Sometimes we may say yes. In upcoming years actually we may require to do PGS for everyone, every infertile patient, because people are not having so much time to undergo so many treatments, to undergo treatments for years together, to undergo treatments for months together. If they want to conceive at any cost, they want to spend their money, and PGS is bit costly, but PGS will give good result. IVF failures, 3 times, 4 times IVF failures, 60 failures, they have to go for PGS. Any gene known, knowingly, unknowingly, any gene defect, any single gene defect or single gene mutation, any chromosomal abnormality in the previous families, in the previous children, there are recurrent abortions, repeated abortions. Yes, you have to undergo the pre-genetic screening procedure. So before putting the baby into the womb, we should know whether the baby is normal or abnormal. If it is abnormal, take out the baby. If it is normal, keep the baby in the endometrium. So definitely PGS is required for many people nowadays. Even though it is costly, the result will be good. So better undergo PGS, better to have baby as soon as possible.